So I'm Rajiv, Leventhal, the Managing Editor of Healthcare Innovation. We're live fresh off the stage here with the First Place winner of the 2020 Innovator Awards program. That's Hennepin Health in Minneapolis. I'm here with Alex Knudsen, who's the clinical informaticist there, Hillary Hume, who's the Director of Clinical Innovation, Molly Huff, who is a nurse care coordinator. And we're going to talk just quickly about the project. So the project was this multi-layered effort. It was tremendous. It was about identifying homeless patients or high-risk homeless patients who would be high healthcare utilizers, and then developing this tool to identify them, and then intervening with appropriate care management. It reduced readmissions. I think it's only a year into the project, but there's some great goals here, some great work going on. Let's quickly talk about one or two key lessons learned from the work that you think can be replicable, scalable for the attendees here, for other providers going forward.
So I think I'll just start. Say thank you for having us.
Yes,
We're
thank
so
you.
excited, really excited to get out of Minneapolis on that. But I think that what we've learned is that the electronic health record and the amazing work that we can do within the electronic health record is just part of it. It's just a piece of it, and relationships tend to help us solve these issues. And Molly, if you want to talk.
Yeah, I would.
Lessons on that.
Yeah, I would say the biggest lesson has been definitely having a shared EHR and just shared information with social services as well as health services, and also getting the right person in front of the patient at the right time. We're able to, because of the innovations that Alex has created, we've been able to, as a nurse, meet people inpatient and help connect them with care coordination while they're inpatient and bridge them to outpatient, and that's been the biggest learning.
Yeah, the care management and intervention involved in this project, the effort that was involved was just so tremendous, and it stuck out to us. And I think out of the cohort, the eligible patients, only one person got readmitted within a 30-day period, compared to several more from the control group, and it was just tremendous stuff. Alex, from a data standpoint, can you talk just a little bit about, for the informatics folks here, what went into it from a data element standpoint?
Sure, yeah. So social determinant data is sort of in its infancy in terms of being incorporated into EHRs. So that always poses a challenge to interventions like this, where we want to work with that population specifically, that sort of population health view. So we incorporated data that comes in through our shared EHR with many partners in our whole county, really, in order to better identify patients. We've used some kind of novel techniques in the past based on address data as well to help identify homeless patients, and are now working towards identifying patients with substance use disorder that might be kind of a comorbidity. So all of those pieces really presents kind of a risk score, or a risk tool overall for nurses to review, along with all the other clinical data, and determine which patients need an intervention.
Yeah, when you look at broadly across the U.S., healthcare organizations are kind of struggling from a business standpoint of being in two different buckets of fee-for-service and value-based care, and there's so much momentum building towards SDOH and incorporating and integrating it, properly addressing it, screening for it, but so many questions still to be determined. But you guys didn't really have to sell your board, your executives on this project, even though it's really built around non-clinical elements. Can you talk about how important that was?
So I think that we are very fortunate to work in one of a county-owned system, as well as having our healthcare providers and our health plan. And I think that what we brought to them was, they just said, this is our mission. This is what we do. We serve the underserved. And I think that if you just stick true to that mission, if that's really what you want to do, I think that was really something really valuable. And we did not have to sell. They celebrated that and continue to use our project as sort of a highlight of lean and working together. We used lean processes, which are great. Can't do without it. Just nothing better to say.
Doing the right thing more important than filling the bed. It's great to be here with the First Place winning team, the folks from Hennepin Health. Thank you so much, and it's a wrap from San Diego.
Thank you.
Thank you.